you to really know what to look for in your slides, especially for those who are taking histology for the first time. So, okay na yung may mga medtex, may subject na nakasugat natin na histology in their college preparatory course. Now, for those who will be encountering the things that we will be looking under the microscope, it will be beneficial if we will start our laboratory sessions with the slide discussion. Now, your lecture this morning was on bone marrow. Before we proceed to the bone marrow tissues, unfortunately for you, you will always have a quiz every meeting. Now, the coverage of the quizzes per meeting will be the topics which were previously discussed. So that expectedly on Monday, we will have a quiz, the coverage of which will be bone marrow. Okay? So it may be in the form of a practical quiz or a written quiz. So anyway, in the long run, it will be beneficial for you to have many quizzes kasi parang raffles ticket. The more tickets you buy, more is your chances of winning. For the bone marrow, we will be able to see, by the way, before we discuss the components of the bone marrow, what is the function of the bone marrow? Hematopoiesis. What is hematopoiesis?
Production of blood
cells, white blood cells, red blood cells, and then the platelets. Now, although there are three cellular types present in our peripheral circulation, yung dalawa lang na cell types ang nagre-predominate sa loob ng bone marrow tissues natin. These are the cells which are responsible for producing the granulocytes. Aside from the neutrophils, what are the other two?
Eosinophil, basophil.
Okay, the eosinophils and the basophils plus the neutrophils will comprise the granulocytes. And then, aside from the granulocytes, this series or lineage, natawag siyang lineage because dito natin makikita ang production or maturation ng blood cell from its stem cell or precursor cell up to the mature form. So that's a lineage. So aside from the granulocytic lineage, which can also be called as myeloid lineage or myeloid series, another predominant cell lineage that will be seen most of the time in your bone marrow slides will be the erythroid series. So mayroon pang ibang series, lymphoid series, the monoblastic series. We will not anymore discuss those series because as you shall see later, hindi sila makikita most of the time sa bone marrow. And then most of the time in the practical exam, what will be coming out will be cells belonging to this series or the erythroid series. So that we will focus more on the granulocytic or the myeloid series and the erythrocytic series. Now, there will be two slides that you will be examining later. So one is called the bone marrow smear. Itong anahin natin pag-discuss. And then the other one is the bone marrow tissue biopsy. More difficult to examine will be the bone marrow smear. This is why we will begin with that slide. So we will begin with this series or lineage, the granulocytic series, or the granulocytic or the myeloid series or myeloid lineage. Now the first identifiable cell of that series in a bone marrow smear is that cell, the myeloblast. Now, what are the characteristics of a myeloblast? Now, ideally, a myeloblast should have a circular to round nucleus, just like that blast. And then, ito, nag-fold na ang kanyang cytoplasm, kaya seemingly, nag-fold din ang kanyang nucleus. And then, what can you say about the size of the nucleus relative to the volume of the cytoplasm?
Large.
Okay, that cell will have a very large nucleus. And then, comparing the color of the chromatin content of the nucleus as to the other cells in the lineage, that cell will have a more or less clean
appearance of its nucleus. Dito may mga granules na, or granulated ng appearance ng chromatin. So, in the textbook, that characteristic pattern of chromatin is called fine chromatin pattern. So or fine or uncondensed chromatin, and then unlike the other cells in our body, the nucleoli of the blast cells will appear lighter than the other types of nucleoli. So yung mga whites na yan, those are actually the nucleoli of the myeloblast. So the nucleoli can number as high as 5. So normal range is 3 to 5. Itong blast na yan, mayroong 1, 2, 3 nucleoli. And then the cytoplasm will have a very light color. So those are the characteristic features of a myeloblast. Walang granule sa kanyang cytoplasm. So the next cell in the series or in the lineage, pag mag-mature na itong cell na ito, it will become a promyelocyte. Notice na dito sa diagram na ito, schematic representation of this cell, walang granule. And then dito naman, sa cell na ito, promyelocyte, as you can notice, mayroon ng granules. So, in reality, yan ngayon ang appearance ng promyelocyte. So, it will show violet to blue colored granules in its cytoplasm. So, because the granulocytic cells are called granulocytes because of the presence of granules in their cytoplasm. Now, particularly for the promyelocyte, it will contain only one type of granules. So these are the azurophilic granules. What is the other name of the azurophilic granules? Primary or specific? Primary. Very good. Now, isa pa lang na type of granules ang makikita sa kanyang cytoplasm. So these granules can be colored blue or violet. So that is now the appearance of a promyelocyte. So compare the appearance of the cytoplasm, which contains granules, as to the cytoplasm of a myeloblast. So the cytoplasm is clean looking as compared to the dirty looking granulated cytoplasm of a promyelocyte. And then as you can notice, there is a clear area immediately beside the nucleus. That is because of the nature of the contents of the granules. Ano bang laman ng granules ng mga granulocytes? Okay, let us relate that question to the function of the granulocytes, particularly the neutrophils. What is the function of the neutrophils? Eosinophils yan. Another promyelocyte with violet colored granules. What is the function of the neutrophils? Ano? Eosinophils yan. Bacterial infection, anong ginagawa nila pag mayroong bacteria? Yes. Phagocytosis, very good. Kinakain nila ang microorganisms, particularly bacteria. And then after phagocytosing a bacterium, what will happen next? How will the neutrophil kill the phagocytosed lysosomes? Or mag-fuse ang lysosome sa phagosome. Anong laman ng lysosomes? Enzymes, very good. The granules are actually representatives of the lysosomes, which contain enzymes to degrade the phagocytosed microorganism. So enzymes are by nature proteins. What are the organelles responsible for protein synthesis? RER, rough endoplasmic reticulum. And then, the produced enzymes from the rough endoplasmic reticulum will be packaged in what organelle? Okay, before the enzymes are delivered to the granules, dadaan muna sa Golgi apparatus. Now, yung clear area immediately adjacent to the nucleus is called the Golgi zone. So that zone is occupied by the Golgi apparatus. Okay? So, a promyelocyte will have a violet-colored or blue-colored granules in its cytoplasm plus the Golgi zone. And then the next cell in the lineage, pag mag-mature yung cell na yan, it will now contain, ayan pala, better view of the violet-colored granules of a promyelocyte. And then when this cell matures, it will become a myelocyte. In this cell, in the series or in the lineage, we can already identify the precursors of the neutrophils, the eosinophils, and the basophils. So after promyelocyte, the cell will become a myelocyte. Now, what can you say about the color of the cytoplasm of a myelocyte in comparison with a promyelocyte? Lighter. Ito, mas magandang appearance ng myelocyte. Mayroong dark-colored or violet-colored granules, mayroon ding pink-colored granules. So that the cytoplasm will now contain two types of granules. The primary granules, or the azurophilic granules, will now be accompanied by specific granules. So, promyelocyte, only primary granules. So, myelocyte, the cell will now contain both azurophilic granules and specific granules. That is why there are two hues or two colors that will be seen in its granulated cytoplasm. And then the next cell in the lineage is the metamyelocyte. This cell will also contain the azurophilic granules plus the specific granules in its cytoplasm. The only difference from the myelocyte will come in the shape of the nucleus. How will you describe that nucleus?
Indented.
Okay, bean shape, kidney shape, or indented nucleus. It will still possess the two types of granules. And then, the next cell in the series is the bond cell. So, mas lalo pang nag-indent ang kanyang nuclei. Actually, dinidescribe ito sa mga textbook na uniform ang width or ang thickness ng elongated nucleus niya. Nucleus niya at its length. So that's the difference between the bond cell and a metamyelocyte. It will still contain both types of granules. After the bond cell, lumalabas from the bone marrow, itong mga cells na ito nasa loob ng bone marrow, developing. And then ang pinapalabas ng bone marrow, pwede na itong mature na kaagad, or in cases of severe infection, to combat infection, maski na immature pa, ang white blood cell, pinapalabas na sila ng bone marrow to increase the number of soldiers of the body combating infection. Now, immature granulocyte will have, how will you describe now the appearance of the nucleus?
Segmented.
Okay, segmented. Multilobulated nucleus. Okay, that's a bond cell. Ito, pwede pa siyang maging metamyelocyte. Yan, definitely is a bond cell. So, another appearance of a bond cell, and then how will you call that cell? Neutrophil, specifically segmented neutrophil or mature neutrophil. So, yun ang mga cells belonging to the myeloid or granulocytic series. Mature segmented neutrophils. Now, for the erythroid series. Before discussing the precursors, let us first describe the characteristics of the mature red blood cell or a mature erythrocyte. How will you describe the appearance of a mature RBC?
Biconcave.
Okay, donut shape or biconcave shape. The central area, when seen on top view, the red cells will possess a central area of pallor. So that pale area will represent the concavity of the red blood cell. Now, its cytoplasm is colored pink because it contains what type of protein? Ano? Hemoglobin. Hemoglobin is a protein which is still synthesized in what organelle? Particularly, what type of RER? So, please remember that because it will become significant in the appearance of the precursors of the red cells later. Now, the first identifiable stem cell or precursor of the red cells in the bone marrow is that cell, proerythroblast. So, blast cell pa rin, just like the myeloblast. Now, in some books, that cell is also called as the pronormoblast. So, pronormoblast, proerythroblast, sa pangalan lang nag-differential, pero same banana pa rin yan sila. Proerythroblast, pronormoblast. What are the identifying features of a pronormoblast? So, just like the myeloblast, it will have a fine appearance of its chromatin in the nucleus. So, fine kasi as you can notice, as the cell matures, mayroon ng maraming granulation sa kanyang chromatin. And then, ang isang ginagamit ko na identifying feature sa mga erythroid series cells is the presence of holes in the nucleus of the precursor cells. So, madumi ang nucleus, parang mayroong maraming butas sa loob ng nucleus, aside from the granular appearance of the chromatin. Now, let's go back to the pronormoblast. So what can you say about the color of the cytoplasm of this pronormoblast? Okay, dark, basophilic. Dark color, the basophilic cytoplasm. And then, the cytoplasm is not completely basophilic. Immediately surrounding the nucleus is a pale area which is specifically called as the perinuclear halo. That is another identifying feature of a pronormoblast. So, very large nucleus with fine chromatin, just like the myeloblast. However, we will not be able to appreciate the nucleoli. So, aside from the absence of the nucleoli, the proerythroblast will have a very dark colored or basophilic cytoplasm with perinuclear halo. Ang pinaka-distinct characteristic ng promyeloblast, however, not all proerythroblast will possess this feature, is the earlobe protrusion of its cytoplasm and plasma membrane. So, wala pang explanation bakit nagkaganyan, bakit merong ear-like protrusion ng ibang proerythroblast but not all proerythroblast. Pero pag may makita kayo ng ear-like protrusion, parang Mickey Mouse appearance, and then very dark ang cytoplasm with perinuclear halo, yun na ang pronormoblast. Now, after that cell matures, it will become that cell, basophilic normoblast. Basophilic because of the intensely basophilic color of its cytoplasm. And then dahan-dahan ding nawawala yung perinuclear halo. Now, let's go back to the content of a mature red blood cell. Pula siya because of the hemoglobin content. That basophilic appearance is imparted by the organelles responsible for protein synthesis. What are the organelles? Okay, the rough endoplasmic reticulum plus the mRNA and the rRNA molecules will contribute to that color, to the appearance of that color, basophilic cytoplasm. And then, pag nag-produce na yung cell na yan ng hemoglobin, which is colored red, it will now become that cell, polychromatophilic erythroblast. Poly comes from many, and then chroma, color. Many color kasi dalawang colors na ang ma-appreciate natin sa kanyang cytoplasm. Blue, representing the RER and the RNA molecules, plus the pink, which is already the hemoglobin molecules. Dahan-dahan na nagproduce yung cell na yan ng hemoglobin. So aside from that, the chromatin will also become condensed and granular na mayroon na ngayong appearance ng mga holes in the nucleus. So after that cell matures, after makaproduce siya ng adequate amount of hemoglobin, it will now be called an orthochromatic normoblast or orthochromatic erythroblast. Ortho comes from, is actually equivalent, ortho is actually Latin, equivalent niya sa English is right. And then chroma again, color, right color of the cytoplasm. Kasi, yan ang color ng cytoplasm ng mature red blood cell, walang nucleus. And then compare the color of the cytoplasm of the mature red blood cell to the color of the orthochromatophilic normoblast. Almost the same. So, exact or correct color of the cytoplasm. And then, picture lang kasi ito. Pero ideally, or in reality, pink talaga ang color ng cytoplasm niya. And then what can you say about the size of the nucleus compared to the immediate precursor, which is the polychromatophilic normoblast? What happens to the size of the nucleus?
Small.
Okay, nag-decrease ang size because eventually it will become eliminated from the cytoplasm for the cell to become mature. Bakit? Bakit kailangan tanggalin ang nucleus? Is that the actual explanation in the book? Ano? Nice try. Ano bang function ng mga red blood cells?
Carry.
Okay, aside from oxygen, carbon dioxide also. That function, that capability to perform that function is imparted by what particular component of the red cells? The anong component ng red cells ang nagkikarry ng oxygen and carbon dioxide? Hemoglobin. Yun lang ang function ng mga red blood cells. Pag mayroon na siyang hemoglobin, the cell will not anymore perform any synthetic function. Kaya, useless na ang nucleus niya. Kaya kailangan pwede nang tanggalin sa kanyang cytoplasm. So that before a red blood cell leaves the bone marrow, it will release its cytoplasm to become the cell, a reticulocyte. Now, for the medical technologists in this group, what stain is used to identify the retics? How do you call that stain? Ano?
Jensen.
Okay, vital staining.
Vital stain.
So, dyan makikita sa vital staining ang blue colored granules which will represent the remnants of the rough endoplasmic reticulum and the RNA molecules. So, hindi pa napalabas lahat. Or meaning, ongoing pa pala ang hemoglobin synthesis. So, tinanggal ng nucleus kasi useless na. So, a reticulocyte, aside from possessing the RNA and RER remnants, it is also larger in size, relatively larger than the mature red blood cell. And then if the hemoglobin synthesis is already finished, that is now the appearance of a mature red blood cell. So that's the usual range of size, 7 to 8 microns, which is equivalent to the size of the nucleus of the small lymphocyte. Anyway, we will be discussing that further next meeting, pag nagpunta na tayo sa blood cells. Now, those are the cells which you should be able to identify for the bone marrow smear or bone marrow aspiration biopsy smear. Erythroid series, and then the myeloid series. Ito namang next group of cells, pwede na istadihan natin sila sa peripheral blood smear na lang. Kasi most of the time, itong mga monoblast, precursor of the monocytes, and then the lymphoblasts, the precursors of the lymphocytes, you will not be able to see them in the bone marrow smears. pag normal. Hindi na lang natin sila isali sa slide discussion today. And then, what are the precursor cells of the platelets?
Eukaryocyte.
The megakaryocytes.